Hello, my name is Dr. Gill. I've been asked to do a lower limb neurological examination today. So that's going to be looking at the nerves that basically let you walk around. Before I start, can I please confirm your name and date of birth?
Anita Kumar, 8972.
Super, thank you. So what we're going to ask you to do, in a moment we're going to ask you to do some walking, and I'm going to ask you to do a couple of extra tasks with the walking to make it slightly more difficult. I'm going to get you to stand to test your balance, and then I'm going to get you up on the couch and we're going to do some movements and test your powers and things, and also look at your sensation and coordination. Are you happy to proceed with that?
Yes.
Okay, so to start off, if I could ask you to walk over to the side, walk 5 paces down towards the windows, turn and come back, please. I'm going to observe your gait as you do so. Okay. 1, 2, 3, 4, 5. That's fine if you could turn. And now I'd like you to walk back heel, toe, please. So we're just making that gait a little bit harder. Thank you. And if I can ask you to turn around. And we're going to walk back, just walking on our heels, please. Superb, thank you. So if you'd like to come back and join me again here. Okay. So what I'm going to do now, we're going to test for what's called Romberg's sign. So what I'm going to do is I'm going to stand very close to you with my arms by your sides. And I'm going to ask you to close your eyes with your feet standing just 2 centimeters apart from each other. So I will make sure you don't fall, but we're testing to see if your balance is impaired. So if you close your eyes, please. And then we'll wait here the 30 seconds. Okay. So what we're testing here is your body's balance, and that requires 3 things. It requires vision, which we've now removed. It requires hearing, which is intact, and hopefully proprioception, your body's ability to determine where it is in space and time. Now, normally, these 3 systems work together. Your balance will remain normal with one of those 3 systems impaired, but if there's only one remaining, then you'll have a problem with balance. We've removed your vision, so if either the hearing or the proprioception is affected, then we'd expect you to have a problem. That's fine, open your eyes for me. And we're going to make it slightly more difficult, again keeping your feet 2 centimeters apart. You should cross your arms over your chest, please. And again, I'll make sure you don't fall. And counting again for another 30 seconds. And again, we're waiting for that 30 seconds to see if you develop any abnormal movements and things like that. But don't worry, this is a harder one to do, so you will naturally just sway a little bit more than you did before. Okay, that's fine, thank you. So you can open your eyes. So absolutely no problems there. If you'd like to follow me over here and climb up onto the couch for me, please. Okay, and if you lie back, please. So I'm going to start off by having a quick look over your legs. I can't see any obvious fasciculations. There's no muscle wasting. I can't see any twitches, and there's a small contusion to the knee, but nothing else. So I'm going to have a look at the tone. So I'm going to put my hands on you, if that's okay.
Yes.
Just going to look at the movement of your foot. So I've got a nice, soft roll there. And again, it's rolling backwards and forwards without any sharp, brisk movements. That's excellent. Now I'm just going to pick up the knee. Great. And no evidence of hypertonia there. And then finally going to look for evidence of clonus. So turning the leg out, feeling over the calf, and so there's 2 beats of clonus there. And do the same again on the opposite side. Okay, we've got 2 beats of clonus there, thank you. So we're now going to test your powers, so I'm going to ask you to do some movements, please, and I'm going to try and stop you doing them. So I'm going to put a hand over your thigh. Please could you raise your leg up? Brilliant. Could you raise your leg up, please? Brilliant. I'm going to put my hand underneath, so if you could push your leg into the bed, please. Super. And again, if you could push your leg into the bed. Fantastic. So I'm just going to pick your leg up slightly. Okay, staying with the knee. Don't let me straighten the leg. Okay, and don't let me push your heel to your bottom. Great, relax for me. Do the same again here. Don't let me straighten the leg. And don't let me push your heel to your bottom. Super, and relax for me. Okay, so having finished with the knee, I'm going to go back to looking at the hips. So I'm just going to move your legs slightly. Okay, now please don't let me move your legs. I'm going to try and do a deduction, so push your legs together. Great, and I'm going to try and do a abduction, move them apart. Fantastic. I'm now just going to move your feet. Okay. Please now don't let me move your feet, so I'm going to push them down. Don't let me. Super. And now don't let me push your feet up. Fantastic. I'm going to try and turn your feet. Don't let me. Great. And I'm going to try and turn them out. Don't let me. Super. I'm going to try and move your big toe. Please don't let me. Okay. And don't let me push it up. Fantastic. Please don't let me push your big toe down. Great. And please don't let me push it up. Fantastic. So they're normal powers throughout. So now we're going to check your sensation. So I'm just getting the cotton wool and then twizzle it to a point. I'm just going to touch the base of your neck. You can feel that?
Yes.
Super. So I'm going to do the same now, pressing on your legs. If I could ask you to take your socks off, please. Super, thank you. So we're now going to touch over your legs with the 12 bit of cotton wool. The trousers are unfortunately in the way, but we'll still try this. So if you close your eyes, please. So please say yes if we touch you.
Yes. 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 Yes.
Super, so that's all normal. Just going to get the nearer tip. So if you close your eyes, please. And touching over your chest, you can feel that?
Yes.
Super, so same again. Say yes when you feel me touch you.
Yes. 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 Yes.
Super, thank you. So I'm going to get the tuning fork. I'm going to strike your big toe. So if you close your eyes, please. You can feel the vibration.
Yes.
Tell me when it stops.
Stop.
You can feel the vibration.
Yes.
Tell when it stops.
Stop.
Thank you. We could also at this point go forwards to test hot and cold temperature sensation, but we won't do that at this point. So we're now going to carry on looking at proprioception. So I'd like you to take this heel, touch it to the back of your foot, run it up the front of your leg, and then back to touch your big toe in a D shape, please. All the way down and back in a D. Excellent. That's fine. If you could swap sides for me. Doing the same again, going to the toe, up the front of the foot leg, and then back. Super, thank you. Super, thank you. Okay, so I'm going to put my hands under your feet. If you could just tap them for me. Super, that's fine. So we're going to look at proprioception. So I'm going to take your big toe. So if you close your eyes, please. So I'm holding either side of the foot and I'm just going to wiggle it. So that is up and that is down. Okay, so wiggle, wiggle, wiggle. Which way is it pointing?
Up.
Wiggle, wiggle, wiggle.
Down.
Wiggle, wiggle, wiggle.
Up. Up.
Super. And we'll do the same again on the opposite side. So that is down, that is up. Okay, wiggle, wiggle, wiggle.
Up.
Wiggle, wiggle, wiggle.
Up.
Wiggle, wiggle, wiggle.
Down.
Wiggle, wiggle, wiggle.
Up.
Wiggle, wiggle, wiggle.
Down.
Fantastic, we've got no issues there. So you can open your eyes. So I'm going to check your reflexes now. So I'm going to start on the feet moving upwards. I've got a sharp tip on the end of the tendon hammer. So I'm just going to go round the outside of your foot and see what happens. 1, 2, 3. Okay. 1, 2, 3. Okay, so we've got no problems there. I'm just going to turn your leg inwards, bring the leg up, dorsiflexing, and excellent, good reflex, and relax down forward. And we'll do the same again on this side to bring it up, dorsiflexing the foot. Superb, and relax for me. If I get you to sit up, please, and swing your legs over, and we're just going to check the reflexes on your knees. So I'm just going to get the tendon hammer, being careful of the contusion. Okay, that's fine. And we're going to do the same again on this side. Okay, so we're slightly reduced on that side. I'm going to try and increase that reflex. So if you could put your hands together and pull, and if you close your eyes for me. Okay, that's a better reflex there. Super, you can relax for me. So that completes our examination. We haven't found any abnormalities. Do you have any questions for myself?
No, I don't.
Super, thank you very much for your time.